Okay, so welcome again. Last session of the day. Thank you very much for coming back, being here. Hope you had a good time networking, having this coffee. And we have to finish with our last, but a very, very interesting panel, moderated by Yorima Cosio, who's joining in the stage from Hospital Vall d'Hebron. And I would like you to introduce your panelists and the people who's going to join you in this session. So,
this topic, then it's very interesting from digital chains. So Juan Carlos is also master in healthcare management, health economics, is postgraduate in public policies management and health challenge from the University of Harvard. Also, he is former healthcare director of Indra, ex-advisor of the Cabinet Office of Spanish President, and a strategy management and consultant at Antares. So a lot of knowledge. Thank you very much for being here. So let me continue with Dr. Miguel Pera. Dr. Miguel Pera is the medical director of Hospital del Mar. He's also a chair of surgery at the same hospital. He is the background is surgeon in colorectal, and he was specialized in the Clínica Mayo, also research fellow at the same Clínica Mayo. So he is also professor of surgery at the University of Pompeu Fabra. Thank you very much, Miguel, to be here. So he's going to show us all this vision of clinicians and also director of the hospital and the challenge that hospital had to introduce all this technology. And the last but not the least is Marc Gomis. Please, Marc, come here. Marc is a clinical pharmacist. She is also a doctor from the Autonomous University of Barcelona, and the thesis was related with improvement in clinical practice using technology and health technology. So more than 10 years experience in all interdisciplinary and comprehensive e-health projects, coordinating this project, and now one of the more important roles and the knowledge that you're going to share with us, Marc, is related with your current position, that is director of the unit of digital health here in São Paulo, and also she is the head of Digital Health Clinical Validation Center. Thank you very much for being here. Thanks to everyone. So I think that this last panel is very interesting because we're going to talk about the real life, about what's going on in the hospital, what are the challenges that we have in the hospital, and how are we tackle all these challenges with digitalization. The name of this panel is Empower Hospitals. So we have the vision here of a clinician, that is also director, a director of digital health, and also a person that have a lot of experience in the healthcare, but also in startups and in companies. So from my experience, and I have to say something that I didn't say when I start, who had the role of moderate this panel was Layernal, that is here, but for some reason he couldn't do that. Then I'm here in the role of moderator, but also want to share with all of you my knowledge and experience. I'm a medical doctor, preventative medicine specialized, and I'm director of system IT in Hospital Vall d'Hebron. So it's very common for all of us, all the situation of the hospital when we want to introduce some new technologies. So we can talk a lot about the difficulties and the challenge and how this innovation came to the hospital and how we scale up all this. But I don't want to talk right now about the challenge. I want to engage everyone with this panel and start to speak about the good experience. What are these projects that are really we are running in our hospital that we can say that is not a little pilot, that is something that we have results and that really changing the life of our patients. So it's not easy because we're talking about all the benefits of digital health all this time. It's not easy because when you're going to apply all these things, there are some challenges. But I'm sure that we have good things to talk about. Then let me start with Dr. Miguel, for example. As a clinician and medical director, tell us a good experience with digital chain in your hospital, please.
Thanks very much. Yes, I agree. Introduction of digital transition, digitalization in the process of care of our patients is a major challenge. And in most of the cases, it's much slower than we would like. But of course, we have already good experiences and have already experiences that are already having a major impact on our patients, as you asked. And one of the examples at Hospital del Mar is, for example, the digitalization of the Department of Pathology. The Department of Pathology in our department, I would say, at this time, more than 50% of the caseload of our pathologists is already digitalized. In some cases, in some pathologies, for example, in lung cancer, is almost 100%. Of course, when we talk about digital pathology, many of us think about artificial intelligence, but this is the end of the road, probably. But before that, there are many other advantages. And when you were talking about changing the life of our patients, but also the life of our professionals. And when you talk to the pathologists, they are really enthusiastic about the digitalization of their work. This is truly a game changer. And for example, one of the advantages is the quality of the images. They are able to measure with much more accuracy. And for example, as a surgeon, I know that in some instances, 1 millimeter of difference, it makes the difference between deciding to operate or not a patient, just 1 millimeter in a slide of a pathology. So this is one of the advantages. Of course, they can compare images of the same patients. They can they can assist other pathologists in the other side of the world, and this is something that they are already doing. And of course, this is something that we are already doing, but we are already working in some algorithms of artificial intelligence to make a much more precise diagnosis in lung cancer and breast cancer, and can also avoid many other unnecessary stainings. And if we are talking, when we talk about a sustainable wall, one major problem in pathology is the storage of the slides, and this is something that disappeared with this transition of digital transition in the Department of Pathology. There are many other examples. For example, in the case of endoscopy, we are already using softwares with artificial intelligence that may highlight a very small polyp that the endoscopists could miss, and one of the missing lesions is one of the main problems in endoscopy, and they are already working with this aid. And many other examples that Jordi Martinez, who is here with us, he has supported with very enthusiasm, for example, the use of apps to monitor at home very complex patients, not the traditional ones, very complex patients with, for example, with ALS, amyotrophic lateral sclerosis, patients that receive mechanical ventilation at home, and we can monitor them with a specific app. These are some of the examples that we are already using, and as I said, it's already having this digital transition a major impact in the care of our patients.
Really interesting, Dr. Pera. Mar, from your experience, you say that you coordinate a lot of e-health projects, but also now in the Hospital São Paulo. You here just since June, then I don't know if in this short time you have the opportunity to see a digital experience that finishing a good experience.
First of all, let me thank you all for inviting me to this panel. It's an honor to be here and sharing with you the insights from the São Paulo Hospital that's near from here and that's hosting you too. And with this engaging title that we have, Empowered Hospital. So for me, it's an honor to explain you some of the experiences that we have at the hospital right now. Yeah, the unit that I am directing, the digital health unit that I am directing is very new, but the hospital is doing digital health for the last years. I am doing that for the last 10 years. So I wanted to share with you today the experience using these platforms, or these platforms used by for telemedicine purposes. So I wanted to share the results that we had in heart transplant patients, but also in other populations, complex populations, as Dr. Pera says, as HIV, hematological patients, for example, but among others. And in all these projects, we are receiving the feedback of these patients from these platforms. You know, the very famous concepts that we are using nowadays, that is PROMS and PREMS, the experience and the outcomes that the patients are registering in these platforms. So it's very useful to be able to exchange experience with the patient and also manage complications, side effects, symptoms before the patients come to our hospital with a real complication or event. So in fact, I think that we are using what is called human-based technology. So we are using that for individualize the healthcare that we are bringing to our patients by using all this data through the technology. We have already demonstrated in clinical trials a reduction on the cardiovascular risk of these complex patients that I mentioned, but also reducing the number, for example, of infections, but also other variables that are impacting in the patient survival. So we also are analyzing and publishing data about reducing the number of emergency room visits and readmissions to our hospital. So I wanted to share that with you. I know that it's telemedicine. We all talk about telemedicine, but we have real facts that, for example, telemedicine is cost effective. We are empowering our patients. We are bringing to them the power of decisions. They are empowered too. So they are making better decisions, and they are sharing this data with the professionals, the healthcare professionals, to let us to prevent and to avoid that they come to the hospital with a complication. Thank you.
Very shocking to know that with digital medicine, we are reducing or improving the survival of the patients. It's a topic that maybe we will speak about later. It is ethical not to use that. We know that improve the survival. Anyway, I'll leave a pin in that, and I'd let the word to you, Juan Carlos. Please tell us some good experience with TON implementation in a hospital, please.
Yes, thank you very much. Well, I will explain two experiences. I think we'll draw very clear the example I want to show with you. One is that since 2015, we are working with a big company that works with insurance and providing healthcare services for 8 million people in 11 countries. And today, we provide to them all the services to manage from the appointment to the following of the patients outside of the hospitals. And that means that only in the part of the appointments, today, in one of that countries, we schedule 4 million appointments every month. That means 200,000 every day. So technology makes that possible, that huge volume of people that takes appointments in 641 cities and to 9,200 institutions. But the special issue here is that the organization prevents the complications of chronic diseases. So for them, it's very important to manage them following programs to manage chronic care. So the evolution of our platform has been in order to introduce that way of following big programs for big numbers of people. Imagine, like in the case of diabetes, we have usually 10% of population with diabetes type 2. So in order to follow this volume of people, I mean, if I have, let's say, these 8 million people, well, we are talking about almost 1 million people with this disease. So in order to follow them in the different stages of the disease, we have several programs and several activities followed along the year. In order to program this volume of activities in all these hospitals in 641 cities And knowing each patient was our challenge all these years. And today we are doing that for an organization which their main objective is to prevent complications and reduce the problems of the complications of these patients. So technology and healthcare have a good mixture here. And the second example is because of COVID. COVID demand us to, thank you. COVID demand us a couple of interesting challenges. One was in Colombia, where we were in charge of the vaccination of 5 million people. And the other one was in the city of Buenos Aires in Argentina, where we have in charge of the vaccination of the people of the city of Buenos Aires, 8 million people. So there, and because our learning in this project I explained it before, we were able to activate all the vaccination program in 40 days. After these 40 days, we began with the first doses of 5 brands of vaccines, and in the first 3 months, we were able to finish the first doses of the vaccines. And currently, we are in the 4th doses. So this is possible not only because technology, it's because we work with the needs of these organizations and in big numbers, making us able to offer the connection between the offer and the demand of such services.
That's very good, Juan Carlos, but you talk about this company, the insurance company was a private insurance company, I guess, and also from another different system in South America. Yes. Okay. I just make this point because in a public health here in Europe, for example, it's not easy for a startup start a project in a hospital. Then when I mentioned that we have some challenge, it's because the route to implement all these projects are not smooth. Not for you, not for all the companies that are here, but also not for the managers of the hospital in this case. I receive, for example, more than 100 emails a week from companies that want to introduce the technology to the hospital. From that, I answered 0, probably because it's so difficult to know what is the winner and what the technology that you are looking for. But also I contact people from the companies in a different way. We start probably 30 projects a year, and from these 30 projects, what we really finish is a low percentage because there is a lot of difficulties in the way. Probably we are improving, or from my experience, I think that we're learning a lot. Maybe 5 years ago, everyone speak about artificial intelligence and the apps and how it will change the health of the people. I think that we know, talking about that now, we're talking about how become a really different project, how we change this pilot in a real change in the hospital. So I want to know how many managers of the healthcare system are here. Could you raise the hands that have the role of regulators, director of the hospitals? It's quite interesting. Then I think that the vision that we can give to you, I guess more companies, about how to go to the hospital and what are the challenges that we need to tackle in the hospital and how empower hospital that helping to all this ecosystem of innovation. Then in that way is my second question, knowing who is in the room. What do you consider that is the biggest gap for success pilots, also digital projects, and what is your advice? Your advice for the doctors, your advice for the companies to fill all these gaps? Who want to start? Do you want to start, Mar? Thank you.
If you let me, I am going to change the word gap maybe for challenge. Why not? And we were talking to prepare this panel. I wanted to share three of them. There are several, and I think most of you knows all of them. But let me talk about how can we adopt. You talked about adoption of technologies or solutions into our daily practices, because we are used to do piloting, validations, but we have to think from the beginning on implementation in adoption. So for adoption, in our experience, it's very important to think about how do you have to redesign the healthcare pathway. Not only have to design and develop a solution, a technology. You have to think about how to change the healthcare model, including the perspective of the user, the patient, the professional, etc., to be a success. If we don't do that from the beginning, hospitals, professionals, patients, and technology providers, we are not going to be successful on this purpose. The other challenge that I wanted to share with you is we had identified in the hospital that we have a problem with time, with professionals' time. We have to transform our institutions. We have to transform cultural tendencies of the institutions, but we don't have time to do that. We have to do a lot of clinical work in our daily days. So we have to work with the managers of the hospitals to really give some extra free time. I think this is very, very difficult, but we have to do that, to have free time to dedicate it to transform the healthcare pathways. And our professionals should have time to be involved in these processes to be able to be transformed. And the other challenge that I wanted to share is you already mentioned too, it should be a priority of our management board, because if they support the initiatives, they are supporting the digital transformation of the institution, it's going to be easier. So in this sense, I wanted to share with you that here in Sant Pau Hospital, we are aligned with the direction, with this board, management board. They are supporting a new strategic plan for the hospital, but also an information system plan, and aligned with all these strategies that the hospital is addressing. They created this digital health unit that could be a support for professionals and for the hospital to rise up the digitalization. So I think it's a good starting, a good beginning for our hospital to be aligned with this strategy.
Time alignment, interesting. What do you think, Dr. Pera?
I agree with all the difficulties and challenges that Mar has highlighted, and I can add other ones. For example, the availability of the data may be a problem, and also the lack of standardization of the data, and the problem with integration. I'm not an expert, but the problem with integration, this is a common problem, integration with the IT system of the hospital. But besides these much more technical problems, I would like to highlight another one. You mentioned that you receive hundreds of mails every day with many offers, and I have to say one of the problems is that we have to start from the beginning. Mar also mentioned that it's not only the technical solution, but we have to redesign the clinical pathway. But even earlier, we need to identify which are the unmet needs of the clinicians. And it's essential a close collaboration between the clinicians, the healthcare workers, and the experts in IT, in technical solutions, in digitalization, because if not, the probability of failure is really, really high. And I also received a large number of mails of this type, and I have to say that a number of the proposals that we receive are not really useful, and this is a major problem. This is a waste of energy of many people, so we need to work together. For example, the Barcelona Health Hub is an excellent environment to this, and also within the hospitals, different professionals that are within the innovation units, and also the clinicians must work together to identify those unmet needs, and then start to provide, to redefine the clinical pathways and provide a technical solution. If not, it will fail.
Advantage of your the speech to make a question that probably many people here are asking. So someone who are in charge of a startup who has a good solution, do you think, and from your hospital and perspective, do you think that they have to go to the clinician to show the solution, to convince that it works, or go to the unit, innovation unit, or go to the manager, or what is your recommendation for all of the that know that please don't send email to the IT director?
In fact, in our hospital, Jordi Martinez and me, we work very closely. In some cases, the entrance comes from a side, in other cases from the side. But in all cases, we do an assessment of the solution and we decide. But again, if this solution was not prepared with clinicians on the other side, the probability of being successful is low.
Okay, thank you very much, I agree. Okay, Juan Carlos.
Yes. Well, excuse me. I have different answers for this question, but it's because I spent the last 25 years doing around 180 projects in 14 countries. But the first 15 years I was working in strategy and management. So the kind of projects are very different than in technology, where I've been working the last 8 years. So from my point of view, in terms of technology, the 3 things I have found like the big challenges is first to get in the organization that is thinking about digital solutions or similar, to have a clear view of what they want, the goal. The second is how far they want to go to achieve that, which I name the scope. And the third is if they have a clear definition of what are the acceptance criteria. It means what is the size and the measures of the development you are implementing or putting working on, to say it's enough, because in technology, never is enough. So if it is possible to get that level of definition, the fourth thing that need a project is leadership. Someone with persistence, resilience, intelligence, and flexibility enough to follow all the track and make it possible. Because it's like managing a transatlantic that is very difficult to move it, but when it starts to move, it's very difficult to stop it. So it demands this knowing where you go, and then have the right people to manage that process.
Interesting. Definitely sounds like the project that really failed. Completely agree. Quite surprised that you didn't mention one of the challenge that you said, Mar, that I think that is important and also raised the Journal of Medical Internet Research. I don't know if you saw this publication recently that mentioned that number of digital solutions and started a big number of them doesn't have clinical robustness and evaluation. So probably some that we are really implementing in the hospital, probably no. So I think that this is a a challenge for hospital how to decide how to implement all these solutions if they don't have all the evaluation and clinical robustness, and how to start a project and how to show result in a short time to implement and scaling up these ones if you don't have the result of this evidence. I think that Empower Hospital had to help also in create this evidence. So I want to see your point of view from two public hospitals here in the European system, and also your vision, Juan Carlos, from all the system, the healthcare system that you know working before. What has to be the role of the Empower Hospital in create all this evidence, and what are you doing now? How do you think that we can help to create this evidence, to help the startup, but also to show the right one who wants to start? Juan Carlos, this time?
Thank you. Yes. Well, I think the role has to be first measurement, to measure results, at least in two ways: results in patients, of course, and results in the resources. It means the processes. It means the money. I mean, the measurement of the impact of what you're doing. And the second part is the evaluation of that results. It means compared with your history, but if possible, compare with some kind of standard. For example, in the case of healthcare processes, we use the standards that has been built by initiatives like ICHOM that are working with different hospitals in different countries, defining the kind of data that can be compared in terms of clinical process around specific pathologies. So I think that the hospital can help so much about that.
Miguel?
I absolutely agree that we don't have to expect all the companies to provide us with technical solutions that are already fully validated and with fabulous results. We have to help them to gain that evidence. And this is something that we are already doing with several digital solutions, several technical solutions. We have to provide in our hospital the appropriate environment to do this. We have already done this for many, many years in academic hospitals with research, with clinical and translational research, providing and supporting investigation our clinicians, and many of the hospitals, Hospital San Pau, our hospital have research institutes. Now we have to make exactly the same effort for the digital transition process that we have already shown that it may have a major impact. And before you already mentioned if this is an ethic not to support this and not to implement those measures. So we have to provide, we have to help these companies to gain that evidence. We have to, of course, to facilitate validation of these digital solutions, these tools, but a very rapid process. We have to facilitate a fast-track process in our hospitals to validate the tools. We have to have in our hospitals the appropriate professionals. We have to incorporate in our hospitals new roles, and also to incorporate the strategies to upskilling and reskilling our professionals. Now we have, for example, traditional or conventional radiologists that are experts in augmented reality, and creating this more favorable environment to speed up the digital transition process, and the field where many companies can validate their products and generate evidence is a way to make this process much more faster. And we are obliged to do this.
Thank you very much. Mar?
I totally agree with my colleagues. I share with you all the insights. Let me show you some, or share you some results of this paper that Yolima mentioned, because I think it could be useful for us to understand why we need these clinical validations, to work on these clinical validations that, as Dr. Peras mentioned, we were already working for the last years in the hospitals with the tech providers. So this paper is published, it's very interesting, I think, for you. in this panel too, is published in the Journal of Medical Internet Research this year, and they analyzed clinical robustness of 224 companies. So it was surprising for me when I read it, because they talk about clinical robustness, or clinical evidence, and was defined as regulatory approvals and also clinical trials, so the combination of both. And the authors conclude that 44% of the companies didn't show any 0, 1 to 10, 0, clinical robustness at all. And only 20% of them were scoring 5 from 1 to 10. So I think here the problem, and we are speaking about prescription. We were talking the last year mostly about who prescribes or prescribing digital health. So I think we have to be worried on prescribing high quality digital health in our hospitals. So to address this, I totally agree with you that the last years we are already doing that. We are collaborating with companies, with startups, with tech providers to do that. But we created, together with the BHH, the Barcelona Health Hub, and Sant Pau Hospital, we created a center for the validation, for the clinical validation of these digital health solutions. So it's our aim, it's our goal to facilitate all the procedures of clinical trials, of piloting with real users, with real patients, with real professionals in a real environment. And of course, we have to do it together with not only Sant Pau. We have to build an ecosystem of hospitals to do that, collaborating together. So I think this should be a main goal in the hospitals, to do a quality research with the digital health solutions.
Thank you, Mark. You mentioned a lot of things that are important. I'm so sad that it's just 3 minutes, but I want to speak about other topic. When you mention all this validation that I think that is necessary, and definitely we are the hub to do this thing with hospitals, there is also resources that we need for that. It's not just frequently they come with the idea of this is a free solution for you, you can test that for free. Not in it for free, really there is resources from our professionals, time that we invest in check the solution, in explain how the hospital works. Then it's a lot of resources from the public hospital, from the hospital in general, also from the companies. Then in 1 minute, how do you think that this relationship has to work? Who has to pay the resources? Do you think that the pharma has to be in the middle helping all this technology, or just the startup have to assume all these costs on the hospital, or what is your vision in 1 minute? What do you think? I'm sorry to be a little bit provocative that last time.
Who have to pay for these validations?
Who has to assume?
For the cost of clinical validations, right? Okay. So, yeah, we can talk that the real situation today and the ideal world. So, in the ideal world, it should be a health system perspective. So, I think this is the goal, but I think this is not real nowadays. So, what is happening? The pharma and many other ways of looking for these financial solutions, right, for the tech companies. But I think that we have to work on that. Yeah, I think so.
Thank you, Mark.
Well, I think one can contribute in a different way. Of course, the startups they need how the pharma can contribute, and the hospital, of course, we can always try to get fundings, additional external fundings, and the hospital can contribute, providing the knowledge of their clinicians and the hospital resources to validate the product. And this is something that we're already doing.
My experience is clearly that we have had to show at least some results before. And then the organizations and the people that will pay or provide the money will help because they begin to believe. And then we can get some traction for build that kind of evidence and get more money. But my experience is that we have had to find our money and take huge risks and get some luck.
Thank you, Juan Carlos. For a second, just to finalize this panel, saying that Empower Hospital really think that innovation can change the life of the patients, and we need to tackle challenges like the time, the culture, leadership, and check the needs of the clinician. But in general, we are a hub to generate of this evidence, and we very keen to work together with the ecosystem, putting results for all of us to really validate all these solutions. Thank you very much to all the panelists, and thank you to you to listen all this time.
Thank you. Thank you very much. You can grab your bottle. Thank you. Thank you. Thank you very much. Yeah, you can leave the stage.